And right now on Channel 2 News at 5:30, it is our virtual town hall answering your questions about the coronavirus, empowering you with facts so we can all feel a little less fear.
And thanks for sticking with us, everybody. I'm Michael Wooten.
And I'm Kate Welshhofer. And once again, we're devoting this entire half hour to tackling as many of your questions as we can. And we're going to get right into it with this one. My boss is telling me I have to go to work despite the governor's announcement. Which people don't have to follow the rule and stay at home instead of going to work?
So first, we want to share the facts around this. So this new executive order from the governor that we learned about earlier today takes effect at 8 tomorrow night. 75% of a company's workforce must be at home. Only a quarter can actually be in the workplace, right? Well, the issue is there are exceptions for essential services. We'll go over that full list in a moment. It's pretty lengthy, but the governor and health experts all agree that as many people as possible really need to be working from home.
We need the healthcare system up and running. Doctors have to get to work. Nurses have to get to work. Healthcare workers have to get to work. We need police. We need fire. We need bus drivers. We need daycare workers. All those functions have to happen. So we need a transportation system, because we need people getting to work. Refuse has to be picked up, right? All these functions have to continue. So when they talk about shut down, we have to make sure we're operational and healthy and functional.
So here's the list of businesses that are exempt from this mandatory reduction in workforce. You have essential healthcare operations, including research and laboratory services, essential infrastructure, including utilities, telecommunication, airports, and transportation infrastructure, essential manufacturing, including food processing and pharmaceuticals.
Essential retail, including grocery stores and pharmacies, essential services, including trash collection, mail, and shipping services. And you see at the bottom there, news media exempt from this as well.
And also banks and related financial institutions, providers of necessities to economically disadvantaged populations, construction, and vendors of essential services necessary to maintain the safety and sanitation and essential operations of residences or other essential businesses.
Vendors that provide essential services or products, including logistics and technical support, childcare, and services needed to ensure the continuing operation of government agencies and provide for the health, safety, and welfare of the public. So we wanted to go over that entire list. I know it's wordy at times, but it's very important because those are the exemptions based on what the governor said.
Right. Beyond that list, employers can reach out to Empire State Development. They can get a waiver of sorts to also get exempted if they are essential.
We also got a lot of questions about equipment for healthcare workers. This has been really disturbing. A viewer texted us, "I have seen pictures of nurses and doctors creating their own masks. This is shameful. Is that happening here in Western New York?" So we're going to broaden out just a little bit. There are shortages in some places of these personal protective pieces of equipment for healthcare workers, and we wanted to find out what is happening locally.
And as we reported earlier, Catholic Health announced today that the St. Joseph's campus of Sisters Hospital will be turned into a facility strictly for COVID-19 patients. And during that virtual news conference, we were able to ask Catholic Health's CEO about that issue regarding hospital equipment.
How are you doing in terms of having the equipment that you need, especially as you move toward changing the St. Joseph campus to this specialized facility?
We will never want our associates to make impromptu supplies related to protective personal equipment. We are doing our best to procure equipment from around the world. So the biggest challenge we have too was the huge run that the public did on N95 masks by buying masks that appropriately should be used by caregivers at the bedside and not used by people in their homes. It's really used to protect the care workers when they're using the masks. So from our inventory standpoint, it's all relative based on the number of cases that you have, and given the low numbers of testing we've been able to do as a county, no one has enough equipment. It's a matter of how do you save that equipment. So, Michael, I'll tell you this: one of the number one reasons, I mentioned this in my press release, that we cancel elective surgeries is because for every elective surgery, we were using gowns, masks, gloves. Why would you do anything with the word elective in it during a crisis?
Yeah, and so also here, I've heard from some people in the medical community who say we do have this shortage of masks, and they're reaching out to other businesses that use masks, so HVAC or construction, and right now they're putting together a grassroots effort to get a donation drive going with that. So of course that's going to be something we'll follow as well and pass along any information as far as that goes.
Yeah, and that's happening locally. The president said today that some big construction companies around the country are donating masks as well, so people coming together.
It's happening elsewhere, and it's going to be coming here as well.
Yep.
Well, sadly, a lot of people, as we know, are temporarily losing their jobs. We've heard from a lot of you, and we've gotten a lot of questions about unemployment. And this viewer said, I'm honestly not sure where this is supposed to go, but I'm in need of help, and I'm trying to get through to New York State unemployment. The numbers just keep disconnecting on me. I can't log in online, and I've been trying for days since Monday evening, Tuesday morning. I'm looking for some help on what's going on or how I can actually get through to someone. Please help. Thank you. I realize they are very busy and overwhelmed. I just don't know where to turn.
You can almost hear the desperation in the written
Yeah.
words there. So we reached out directly to the State Department of Labor today, and here's what we were told. This is how overwhelming this is. By noon today, they had more than 206,000 logins on their website, many of them, most of them, people trying to fill out unemployment forms. They had 159,000 phone calls just by noon today. It's just overwhelmed the system. The Labor Department has a staff of some 700 workers. They're hiring 65 more right now to try to help with the surge. A spokesperson said the most important message for the public right now is that if you can't get through online or you can't get through on the phone, and you can't file until next week, don't worry, you are still going to get your full benefit back to the date that you became unemployed. So you'll get back pay. You can learn a lot more on all of the rules and the process at labor.ny.gov.
You talk about systems being overwhelmed, and this is one that we've seen pretty immediately, and people have been reaching out to me, whether it's an Instagram message or on Facebook, and this is a question that people have constantly because they're trying to get through and they don't know what to do.
Yeah, they are ramping up the network to try to handle all of it, so maybe just a little more time. Moving on, though, we continue to get asked about the idea of a quarantine, whether it's statewide or especially in the New York City area. So the governor again today said that is not going to happen.
Yeah, and today he shared a conversation that he had with someone in Manhattan trying to explain to that person that a quarantine is off the table.
It's not going to happen. Well, I hear it is going to happen. I said, but I know, but I would have to do it. And I'm telling you, I'm not doing it. It must have taken me 25 minutes just to slow him down to hear the information. When you get that emotional, that fearful, you literally don't process information the same way.
So clearly quarantine off the table. You
Off
can
the
tell
table
that by
there.
what the governor said there.
Yeah, right. And I think one of the things that he spent a lot of time talking about today as well is that idea of emotional health and saying, I think he said something about it's hard to live life with a question mark. And that's happening with so many people today.
Yeah. Just want to tell the director here, a couple of our stories got back to back. So the answer to this next question is actually before the question. So somehow that got flipped. But if we can, let's go to the next question that we have about vaccines. So somebody said, I've heard a vaccine can be ready in a few months, and I've heard it may not be available until next year. Which is it? When can we get vaccinated and protected ourselves? So the FDA commissioner addressed that today from the White House. Listen to this.
It's a phase 1 trial, so it's the earliest study that gets done. We expect that to take 12 months to get to completion, to actually a time where we could approve a vaccine. We are looking at everything that's coming across our desks as possible treatment options for coronavirus.
That's a big one. I mean, people want to know, when are we going to be able to get this vaccine?
Yeah, and he went on to say there's some promising research into drugs that could help treat coronavirus. Nightly News is going to dig more into that coming up at 6:30 here on Channel 2.
Yeah, and speaking of Nightly News, a very timely question here based on some information we got earlier today. Somebody asking if it's true that coronavirus doesn't just get older people sick. So the word now is that younger people are more at risk than we previously thought. This person asks, is that really happening? So yes, new data from the CDC shows about 40% of patients who were sick enough to have to go to the hospital were between 20 and 54.
So how should we process that information? Well, we were lucky enough to speak a short time ago with Dr. John Torres. He's NBC News medical correspondent. You're going to see more of him on Nightly News at 6:30. But here's Dr. Torres addressing the age issue.
Up until now, we've thought that the ones at most risk were the elderly, particularly above 65 and even more so above 80, because they can have immune system issues and this coronavirus can hit them very hard. But what this study is showing us is that all age groups need to be concerned because it can hit any of them at any time. The CDC found out that all the people hospitalized for coronavirus, 40% of them were between the ages of 20 and 54. And of those people that were hospitalized between 20 and 54, half of those ended up in the intensive care unit, which means they were in critical condition. And so that's how hard it can hit them. And what this is telling us is that anybody, regardless of age, even the 20 and 30-year-olds, need to be extra careful. Social distancing, 6 feet away from each other, not going out in big groups, not going to parties and things like that at this time, because this is a time period over the next few weeks to make sure we all stay as healthy as we can. And that means hand washing, that social distancing we're talking about, and certainly staying home if you're sick.
Those are sobering stats, and especially now.
You hope that gets the attention of people who haven't been paying attention. A lot of younger people who we have seen are not following the advice of the experts.
Right, exactly.